HIV/AIDS continues to be a major health concern in Guyana, with almost 8,200 persons living with the disease. And according to Deputy Program Manager at the National AIDS Program Secretariat, NAPS, Dr. Nicolette Boatswain, significant strides have been made against the HIV/AIDS epidemic. She stated that there has been continued engagements with international, regional, and local partners, sensitization and awareness efforts, testing outreaches, and multiple faith and business entities who joined the fight against the disease. Boatswain revealed that 50,000 tests have been conducted for the year so far. Moreover, Boatswain noted that the HIV/AIDS epidemic cannot be curbed in Guyana if focus is placed primarily on one particular region. She stated that the approach has to be decentralized and national.
We always work to ensure that our services are decentralized, meaning it's not just on the coastland. We work with international organizations and local organizations. For example, IOM is one international organization of migrants that work in regions 1, 7, 8, and 9, providing those HIV prevention and testing services. But also we work to do outreaches in those interland regions at least twice a year. So we have our counselor testers that go in that reach key population or most at-risk persons. We say key populations now, and testings to ensure that testing services are always being provided continuously throughout the years, not just on the...
Boatswain said that the response continues to be impactful and effective, and her team has had to adapt to the cultural differences that exist in some geographical locations, particularly the hinterland regions, since it was discovered that what worked in Georgetown did not have the same effect in rural areas. The Deputy Program Manager stated that at least 2 outreaches are done each year for far-flung hinterland communities.
We have been able to have continued engagements with international partners, regional partners, and local partners to provide HIV prevention services, including sensitization, awareness, and education, as well as it relates to condom distribution, as well as outreaches to provide testing.
Guyana will be embarking on the National Strategic Plan for 2021 to 2030 on HIV/AIDS, where focus will be placed on key populations, target groups including young and vulnerable persons, and collaborations to further sensitize and educate the nation. She called for Guyanese, especially families, to re-educate themselves and desist from discriminatory acts towards those who they know are living with the disease. She stressed the need for support.
Until we get that understanding from our population, it will continue to be a challenge for us to drive an effective and impactful response. We have made significant achievements and strides so far, but Guyana, everybody has to get on board.
On December 1, Guyana observed World AIDS Day with the rest of the world under the theme Communities Make the Difference. I'm Al Griffith reporting for HTP Nightly News.